Reagan Seba. In this video, I am going to be demonstrating how to remove a nasogastric tube. This patient has received an order for their nasogastric tube to be removed after having it in for some nausea and stomach distension. So I am going to be performing that skill. The first thing that I'm going to do is I'm going to gather my supplies. I'm going to need a syringe with normal saline, a M-Assist bag. I'm going to need a bag to put the patient's NG tube once it's fully taken out. And I am also additionally going to take a pad to put underneath them to catch any drainage or fluid. I would also probably bring along supplies for oral hygiene because we're going to be doing that after they get the tube out. They didn't have tissues in their room. I would bring some tissues, and I think that's about it. So I'm going to go into the patient's room, and I've checked the chart to make sure that they have an order for this, and the provider has indeed put it in order. So I enter the patient's room, knock, knock, knock. Hi, Mr. Jones, my name's Reagan. I'm your student nurse. I was in here earlier. We're going to be removing your NG tube, which is awesome. You finally get that out. The provider feels like you're feeling well enough that we can pull that out and start you on a clear liquid diet after this, which it's not going to be that great, but it's better than NPO. So can you tell me your name and date of birth, please? Perfect. And Mr. Jones, do you have any allergies? No? Okay, perfect. I'm putting on some gloves here. So what we're gonna do is I'm going to put just a little bit of fluid. We're gonna check the placement. I'm gonna put a little bit of fluid through your NG tube. Then I'm gonna have you take a couple deep breaths, and then I'm gonna have you hold your breath. I'm gonna pull it out really gently, and then it'll all be over. That's it. All right, so the first thing I'm gonna do is I'm gonna give you this super fashionable napkin to go right under here. I know it's super great. And I would aspirate to check placement, and also I would probably check the pH to make sure that we had a normal gastric pH would be 5.5 or lower. But everything is in the right place as it was the last time I was here. I've checked to see the length, sorry Mr. Jones, is the same place that it was before that. It is, so that's excellent. Alrighty, Mr. Jones, I am going to disconnect you from your suction, okay? And I'm gonna put that right there. Alright, I'm just going to flush your tube with a little bit of saline, okay? And we've got this, prior to this, filled at 10 milliliters. So I could also do this with 30 to 50 milliliters of air, but I'm gonna do it with saline. And there's gonna be just a little bit of cold fluid, okay? Perfect. I'm gonna clamp again, remove that. All right, Mr. Jones, I'm gonna give you an M-Assist basin right here, and I've also got some tissues for you, just in case you feel any weird drainage, okay, or if you feel nauseous. All right, so lost my guy right here. Gonna make that a closed system again so that I can disconnect from Mr. Jones's gown really gently. Make sure I close this. Mr. Jones, I'm going to be really careful here. I'm going to take off this tape, okay? Awesome. And I'm gonna clamp the tube again. Okay, Mr. Jones, we're gonna take it out. I want you to take a couple deep breaths, okay? In through your nose, out through your mouth. All right, and on the count of 3, I want you to hold your breath, and I'm gonna pull it out really gently, okay? 1, 2, 3. Perfect, all done. Mr. Jones, if you need to, you can put some of those tissues there if you're feeling any irritation. in your nose. And grab that. I'm going to dispose of this in the trash can, except this is a simulation. Perfect, Mr. Jones. How are you feeling? Good. So we'll probably do some oral care here after I change my gloves. Mr. Jones, we're going to put you on a clear liquid diet now. Wash my hands. Put on different gloves because I still have to get all my stuff. So what that means is you'll be able to have some water. We might be able to have some Jell-O, some stuff like that, anything that looks clear. But we can't have any real food yet because we need to make sure that your stomach has adjusted and isn't having it, so those same problems that we had prior to putting in the NG tube, okay? And you haven't had anything through your stomach in a minute, so we need to make sure that we kind of ease into it. Then once you're tolerating that, then we can probably advance you with the provider's permission to pull liquids and then hopefully some actual food. I can take this napkin here. How are you feeling? Any irritation, any nausea? No? Perfect. All right, so we've done oral hygiene. Mr. Jones, I'm gonna return you to your lowered bed position and put them in a semi-Fowler's position. I swear this isn't working for me. All right, well, the bed doesn't wanna work, but return him to a Fowler's position and lower the bed. And then I'm going to go to my cylinder here, disconnect from suction. Oh, there we go. I'm measuring how much I've gotten out of there, and then I'm probably going to dispose of the liquid however the facility requires, either putting some solidifying and stuff in there or disposing it otherwise. We're going to get rid of this whole system because it's contaminated from this patient's stuff. I'm going to put that right there. And I would document that the patient's NG tube was discontinued. I would document that they tolerated it well. I would also document the placement of the tube prior to discontinuation, documenting that I aspirated it, what the pH was when I did that, color of the solution when I did that, etc., etc. I would document that I flushed it with 10 milliliters, discontinued it, the patient did really well. We measured the gastric fluid. I will document how much there was, what color it was, that it was disposed of appropriately. And then I would continue to monitor Mr. Jones doing frequent abdominal assessments just to make sure that he is tolerating that discontinuation well. And I think, oh, and I would do all of that with a normal date and time, of course. I think that's it.